I think it goes to the tune of so many other people, I guarantee, don't know about that, but they don't know about many of the things that we've talked about so far. Even when you talk about people who are like, oh, you're a chiropractor. Can you help me with my neck? Can you crack my back? Can you do all these things? We're looking for that quick fix,
Yeah.
right? And again, like we said, and by the way, I think you're a mind reader, because you literally, as my questions came to mind, you just answered them and you went to the next and the next. And you said amazing things about so many MDs are amazing people. They're
Mm-hmm.
great people. Like, they're your friend, you love them, they're beautiful, like some of your patients have said, and you trust them. And it's not that they're doing the wrong thing in their mind. They're helping you in the best way that they know how, but that's
Right.
just the thing. When they go through school, what they learn as the how to is what the insurance
Very different.
companies and the pharmaceuticals want them to know and want them to learn. They're giving you what they believe is the best thing that's going to help you, but really it's suppressing the symptoms, when what we're talking about here is how can you change your everyday lifestyle? Baby steps, one
Right.
thing at a time. What's your goal? Let's create a custom approach for you.
And just because you have a custom approach too, I want to make sure that this makes sense, is sometimes you have to revisit it and say, okay, have we improved? What do we still need to change? Where are we at? Are we on the right path? So back to the MD thing real quick. The MDs are doing what they know, and they're doing what they have been trained. When you talk about somebody learning functional medicine, that's not taught in school. This is taught outside. Just like when I learned acupuncture, that was not taught in my chiropractic college. I learned that actually before I went to chiropractic school. So you have to be able to say, this is my baseline degree. Now, what do I want to have my specialty be in? What do I want to learn more so I can help more people? Any of these people that we talked about, Dr. Hyman, you can go and look up these MDs that are now moving over into the functional space. Is that they'll tell you, I have been a surgeon for so many years, and then I saw that there was a better way to treat people. I was an internist, I was an MD, I was a family practice, and so many things were not working for my patients because what they would their toolbox was limited to certain medications. You have to be willing to learn more. I admire anybody, MD, DO, DC, doesn't matter, who's taken that step and not a weekend course to be, a functional medicine doctor. This can take years to go through and get all the classes and stuff done because there's so much information. What do you want to specialize in? Is it the gut? That can take 9 months just studying that alone. Can it be hormones? That can take a long time. It could be diabetes. It could be dementia. It could be thyroid. There's also a thing where they're all connected. So when people say, I specialize in XYZ, yes, but remember that has a component of all of these other things that go along together. Earlier, I said about the cholesterol. I'll tell you this real quick because I have to make sure I get this out. Cholesterol is so important. We have so many fear factors of having high cholesterol. Cholesterol is going to make you have a heart attack. Please, please, please read the research. This is the thing about cholesterol. We all need it. We all need good cholesterol. 30 years ago, the healthy cholesterol ranges used to be 300. And then some pharmaceutical company came up with an idea that said, hey, I think we can sell more statins if we lowered that number to be around 200. Okay. So what did they do? They gave patients statin drugs to make sure that these cholesterol levels were lowered. But why do we need cholesterol? Cholesterol is not a bad word. We need cholesterol because we need it to make hormones. Okay. You need it for your brain. You need it for the lining of the meninges. You need cholesterol. So if you're depleting it, how are you going to create more? I mean, does that make sense?
Yeah.
It doesn't make sense to me on why so many people are taking a statin. And then I say, where's your number? What's your number? Oh, my doctor is so happy. My number is 140. My number, I have patients. Oh my goodness. I just want to tell them to have a seat because we got to be careful on this one, that their cholesterol numbers are 102, 104. And I say, are we happy with that? Because their idea is that the lower the number, it's good, right? So I'm not here to put down their MD. I'm trying to understand why their MD wanted that to be so low.
Yeah.
And then I went to a world renowned cardiologist and he says that my cholesterol should be low, the lower the better. And then I said, this is talking to a guy. I said, okay, I'm going to look at your other blood work. So I look at the other, because a lipid panel is its own panel. I want to see your other numbers. I look at the other numbers and I'm like, your testosterone is in the tank, because what do you need to make testosterone? Cholesterol. So you're creating your own problem. So then you think, what, you can go get a testosterone gel and that's gonna balance it out? It's not. I said you're gonna end up with man boobs. Excuse the vocabulary. With man boobs and muffin top. I don't care how much you work out. You're not understanding that you've got to have a healthy cholesterol level. 200 is okay. It's a good number. Okay. 300, when they start, that's just so hard to sit there and determine that. Sometimes genetics, 210 is a good number for that person. Okay.
Mm-hmm.
Never is 102, 104 a good number for anybody, because you are not making, we all need our hormones, men and women. Why we have testosterone just like you do, just different,
distribution.
we need to have that balance. And when that's all their focus is I'm looking at cholesterol, I'm looking at cholesterol, I'm looking at cholesterol. And I'm thinking, oh my goodness, do you not let's take a step back, because I don't want them to be upset with their MD. I just want them to be educated so that they can make their own choice. If they choose to follow what the MDs, of course, you do what you got to do to make you understand, but please understand what the potential of these other issues if you don't take care of them. This is why I take care of men so much with the diabetes, is because they're having these issues and they're not understanding why when you hit a certain age, they're not as virulent as they were before. Mm-hmm. And it's like, let's look at your cholesterol. Well, what does my cholesterol have anything to do with it? It has a lot to do with it, because then that's going to affect your testosterone. So let's make sure that those numbers in a healthy, for your body to be making those healthy wise, so that you won't need to have, those little pills that perhaps